Welcome to the HealthiHer podcast. Your host, Dr. Amy Brenner, is a board-certified OBGYN with additional certifications in functional and integrative medicine. This podcast is meant to help women find reliable, relevant information to help them feel better, look better, and live better. Here you will hear in-depth information about hormones, sexual medicine, aesthetics, cosmetic gynecology, and functional medicine.
Hey everyone, Dr. Amy Brenner here, and we're going to talk today about menopause mythbuster number 3. Bioidentical hormones is just a marketing ploy. I got to be honest, I used to think this too about 15, 20 years ago. And the reason is because my management of menopause wasn't taught in medical school. It wasn't taught in residency. Or if it was taught by the drug companies who came in and taught us as residents over lunch or did dinner programs. And we were taught by the drug companies at the time. And when I was a resident, the drugs that were on the market for menopause were drugs like Premarin, Prempro, Activella, BHRT. Those were the common ones. And all of those drugs have a synthetic progestin in it. Some of them do not, and they don't have bioidentical estradiol in it. And so that's what I grew up on. And that's what I treated women with for the first several years of my practice. Quite honestly, until I started having symptoms of perimenopause myself. And up until that time, I saw several patients who were coming to me for their gynecology care, but were going to other hormone clinics and getting bioidentical hormones. In fact, at the time, there was a big clinic in Cincinnati that was doing hormone pellets, and these women just swore by them. And so I would ask our reps and talk to other doctors, and basically the consensus by the drug reps and by my other OBGYN colleagues is that, doctors are just doing that and it's a marketing ploy. There's no difference between those drugs. Hormones are hormones, and saying that it's bioidentical hormones is just a marketing ploy because it sounds good. So now that I'm actually consider myself really a hormone specialist and hormone expert, and I can't even tell you how many conferences and courses and webinars and papers that I've listened to over the years. And I will say that learning about hormones has to be probably the most complicated thing I've ever studied. There's so much controversy about it in the hormone community, in the OBGYN community. And it took me so long to really tease out the data. But nonetheless, as I sit here now, after being a hormone expert now for over a decade, I can tell you bioidentical hormones is absolutely not a marketing ploy. What bioidentical hormones really means is that the molecule of the chemical structure, or the molecule, is exactly the same as what our body makes. Not kind of, sort of. If you've ever seen me as a patient or heard me talk elsewhere, you may have heard me refer to the pharmaceutical drugs as being zombie hormones. And what I mean by that is that they're kind of like our own hormones, but they've been altered just a little so they can be patented. I call them zombie hormones. But nowadays, there are actually FDA-approved drugs that are bioidentical. And the pharmaceutical companies have caught on that bioidentical is better. And why wouldn't it be? We learned this from insulin. A long time ago, diabetics used to use pig insulin, but then technology advanced and now diabetics use human bioidentical insulin. So if that's the case for insulin, why wouldn't it make sense to use that for hormone replacement therapy or hormone optimization therapy? Why wouldn't you take something that your body naturally makes if it's available? So to me, at this time of medical knowledge in 2021, why would anybody still be giving horse estrogen when bioidentical estradiol is available? On that same note, why would any practitioner, doctor, or nurse practitioner ever prescribe synthetic progestins for long-term use when natural progesterone is available? It just doesn't make sense to me. So, bioidentical is a real thing. It's not just a marketing ploy, and it certainly makes sense to replace something that your body used to make.
Thank you for listening to this episode of HealthiHer. You can find us on Instagram, Facebook, and the web. Go to www.dramybrenner.com to learn more. This podcast is for general information only and does not constitute as medical advice, the practice of medicine, nursing, or other healthcare services. No patient-physician relationship is formed. The information in the podcast and any references, material, or links are at the sole discretion of the listener and not meant to be a substitute for professional medical advice, diagnosis, or treatment. Listeners should not delay or disregard obtaining medical advice for any medical issues or diagnoses that they may have, and should seek medical advice from their healthcare provider for any such conditions.